Welcome to the Group 4 Mental Health presentation. Presenters are Kabahug, Dolkar, Galicia, Joy Katakatu, and Kiton. Our assigned community is Malvern. It is located in northeast of Toronto, and it is home to many immigrants of different ethnical backgrounds. In this community, we met our female client, a 31-year-old refugee. She is a victim of sexual assault in her home country and diagnosed with PTSD and HIV. In this presentation, we will call her Miss A. Let us review the PTSD and HIV symptoms. National Institute of Mental Health said that to be diagnosed with PTSD, an adult must have all of the following for at least 1 month. 1. Re-experiencing symptoms such as flashbacks. 1. Avoidance symptoms such as staying away. 2. Arousal and reactivity symptoms such as having angry outbursts. And 2. Cognition and mood symptoms such as loss of interest in enjoyable activities. On the other hand, HIV targets the immune system and weakens it. The symptoms of HIV vary depending on the stage of infection. On the first few weeks, you may feel no symptoms or an influenza-like illness. When the infection progresses, the patient may have weight loss or may have fever or cough. And without any treatment, the patient will have tuberculosis or Kaposi sarcoma. Miss A experienced sexual assault, and as a result, she developed PTSD. Canadian Women's Foundation said that sexual assault and harassment are persistent forms of gender-based violence that are rooted in gender inequality. Recovery from PTSD is not just eliminating the symptoms, but is when the patient regains control over her life. PTSD in assault survivor is higher than its prevalence, so improvement of therapies are needed. HIV is the most dreadful result of sexual assault. Abrasion and cuts through forced entry increases the risk of transmission. Sexual assault is associated with low self-esteem and depression that are also associated with risk behavior of HIV. On the next minutes, we will discuss our client's social determinants of health at risk, barriers to health services, and challenges that we encounter with the client.
The graph shows the number of reported cases of HIV and diagnosis rates overall by sex and year in Canada from the year 1996 to 2018. According to the Canada Communicable Disease Report or CCDR, a cumulative total of 88,881 HIV diagnoses have been reported to Public Health Agency of Canada or PHAC since HIV reporting began in Canada in 1985. The graph shows the number of migrants who tested positive for HIV during an immigration medical exam conducted in Canada in the year 2009 to 2018. In 2018, a total of 1,026 migrants tested positive for HIV through the IME. Of these, 696 were tested in Canada. Here are the legislation to protect women against sexual assault and most especially to protect refugees against any kind of domestic violence. Services to help Miss A. We have Toronto Rape Crisis Center or Multicultural Women Against Rape. We have Women College Hospital or WCH. We have ACT, who offers a range of social supports, educational, and community kitchen programs for women living with HIV and AIDS in Toronto. And lastly, we have Regional HIV or AIDS Connection.
Social determinants of health. Health is influenced by many factors. genetics, behavior, environmental and physical influences, medical care, and social factors are five broad categories known as determinants of health. Social determinants of health include economic and social conditions that influence the health of people and communities. It is affected by socio-economic position, which is the amount of money, power, and resources that people have, all of which are influenced by socio-economic and political factors. In the given scenario, Miss A is a refugee, HIV positive, and suffering post-traumatic stress disorder from a sexual assault that happened in her home country. The social determinants of health at risk for her include a job, access to healthcare service, housing, food, money, social support, language, and culture. As a refugee, there are some concerns about her social status, and her health is affected by HIV. She cannot work in a full-time job due to her health issues. Resources or external partners. The resources and external partners might be useful for Miss A are Ontario HIV Treatment Network, Centre for Addiction and Mental Health, Canadian Red Cross programs, programs of Government of Canada and Ontario. The Ontario HIV Treatment Network is a non-profit network funded by the AIDS Bureau of the Ontario Ministry of Health. Centre for Addiction and Mental Health is a psychiatric teaching hospital located in Toronto and 10 community locations throughout the province of Ontario, Canada. It has 90 distinct clinical services across inpatient, outpatient, day treatment, and partial hospitalization models. It has been the site of major advancements in psychiatric research. It provides counseling and support services. Miss A will get support from her trauma and other mental health issues from this agency. The Canadian Red Cross helps migrant and refugee claimants who have been impacted by armed conflict and other emergencies. Government of Canada and Ontario has different programs for refugees. Miss A can receive help for housing, clothing, food, help to find employment, and becoming self-supporting and other resettlement assistance. Barriers to services. The barriers to services are trauma. It is a very stressful situation. It will affect the total wellness of life. HIV positive in society. There is a stigma about HIV positive patients. The person may suffer from some health issues and need to get constant medical care. It will act as a barrier for them to get a full-time job or attending an education program. Poor financial resources. Few healthcare resources are available in the area for her specific need. Worry about violent reactions from partners for women in abusive relationships. Less access to transportation, lack of housing, lack of emotional or physical support, language barriers. As a refugee can experience integration such as lack of access to education and employment opportunities and insecure legal status.
Strategies in helping the client. Addressing the abuse in a sensitive and non-judgmental manner in order to reduce anxiety. Integrating mental health and physical care in order to help people with HIV and a history of trauma engage in healthcare services. Providing more intensive interventions to help people engage in healthcare, including the use of case managers and social workers who have specific training in abuse, adherence counselors who can follow up with patients closely to assist with medication adherence, and on-site psychological services, outreach and retention specialists, and peer educators. Incorporating psychoeducation that helps patients, clients develop adaptive coping and behavioral skills. It is important that mental health providers attempt to fully understand the presenting problems and their underlying issues in the context of the person's life, including any significant cultural, spiritual, religious, political, economic, familial, and medical factors. Psychotherapy and pharmacological interventions for people with PTSD typically focus on emotional dysregulation. Many current psychotherapeutic interventions focus on providing a safe and secure environment, establishing and maintaining interpersonal boundaries, developing self-efficacy, building self-esteem, and establishing a sense of personal agency and control. How to build trust with the client. Respect. Before patients will listen to providers' information or advice, they need to feel respected. Partnership. The providers who were most respected by were those who were open, discussed options with patients as equals, educated patients as necessary, and allowed patients to direct their own care if that was what they wanted. Time. It allowed patients and providers to assess and accommodate each other's styles and learn to engage and trust each other. It also allowed the opportunity for give and take between the patient and provider. Challenges faced by the community health nurse with the client. Trusting relationship. Trust is threatened when Ms. A may think that nurses are associated with immigration authorities. Communication. The language barrier is challenging while caring for Ms. A. Cultural understanding. Healthcare provision could be challenging when there were different understandings of health, illness, or healthcare. Health and social conditions. Nurses may face challenges in dealing with physical, psychological, and social problems that were typically presented by Ms. A. Time. More time is necessary due to the challenges around building a relationship, communication, achieving cultural understanding, and dealing with complex health conditions of Ms. A. Training and guidance. Nurses thought that specific training and guidance would facilitate their clinical practice, improving their competence and confidence. Even when available, training may be inaccessible due to the lack of awareness or time constraints. Professional support. Nurses may be exposed to distressing stories and are not provided with sufficient psychological support. Connecting with other services. Nurses might face some difficulties referring Ms. A to other health or social services.
In here, we will be discussing the nursing assessment and the consideration for Mrs. A, who is a 31-year-old female refugee who is HIV positive, and she is suffering from the post-traumatic stress disorder after sexual assault in her home country. The nursing care plan for the client experiences such sexual assault related to PTSD and HIV should include assisting the victim to seek medical attention, encouraging verbalization of the assault, informing the family members, and providing the necessary support and follow-up care in relation with healthcare professionals within the community and the clinical setting. The goal of the nursing care related to HIV should be reducing the morbidity and mortality rate and increasing the quality of life. We will be discussing disturbed thought process related to impaired ability to process external stimuli. In here, we should assess the extent of impairment of thinking and post-traumatic stress disorder. We should note the patient attention span or difficulty in concentrating in daily activities. We should discuss the things, events, and the thought that associated with experiences that triggers the stress. We should engage and encourage patient in therapeutic communication continuously to influence the client to verbalize their feelings and thought Through this, the client will feel understood and they will feel more control of their situation. And we should also identify the needs and refers to the appropriate services with clinical and the community setting. And for the second one, we should develop a therapeutic nurse-client relationship. We should assess the client behavior, attitude, problems, and the needs. We should obtain the client's perception of his or her problem and understand what she needs from the relationship or the treatment. We should be honest in every interaction with the client. We should avoid glossing over any unpleasant topic that would make the client uncomfortable. We should also keep our relationship with the client professional, and we should maintain confidentiality of our information and identity. We should never use any judgmental language and approach in any non-judgmental manners. We should establish trust and rapport, since the victim may have trust issue with the people. We should also advocate for the patient whenever needed. And for the third one, next we will be discussing the risk for infection with HIV related to poor socioeconomic status and the stress. So in here, nurse, we should identify the risk of infection. We should counsel the client on benefit of testing, educating on how to reduce exposure and its transmission. We should assess and manage the symptoms. We should also assess and involve the family members' current knowledge as a basis of teaching. We should teach the health promotion and health practices that would avoid the further transmission of the HIV. And we should also provide nutritional support, and through that we can provide her a proper diet protocol. And in terms of economic, we can always refer to the social services that can provide her financial support.
This is the end of our presentation. Thank you so much for listening.